Welcome to the HITea With Grace podcast, where we spill the tea on HIT. Today, I'm honored to introduce you to Leigh Burchell, Vice President of Public Policy and Affairs at Altera Digital Health. Thanks for joining me, Leigh.
Yeah, absolutely. Happy to be here.
So let's start by having you tell us a little bit about your career path that led you to your role today.
Yeah, so I've had an interesting career path. I started briefly for a couple of years in PR and marketing, and it was interesting. I was kind of clear it wasn't really for me. And at the same time, I got hooked up. Well, didn't get hooked up with. I naturally formed a relationship with a really, really great mentor. And he kind of started identifying all these different opportunities for me and just cool projects for me to work on. And ultimately, one of the things that became part of my portfolio was tracking what was the new Office of the National Coordinator, right? So fairly recently launched, there wasn't much going on. And at the same time, Congress had about 0.0001% of their attention span focused on health IT. And they said, track that bill. It was something that Senator Stabenow, who was the senator from Michigan at the time, was putting forward. And so I was paying attention, nothing really happening. And then President Obama ran. He was a candidate. And it became really, really clear that health IT was going to become something the government was really focused on. And so by having all these kind of interesting project backgrounds, someone said to me, hey, would you be willing to kind of build a government affairs function for us? And the rest is history.
Wow, that's amazing. And now everyone knows you, which is amazing in the space. And they're love you, which I'm so thrilled to learn from you today. Thank you so much for taking the time out of your day to do so. So since the start of the new administration, given your background and your experience in the space, what federal regulation or deregulation changes have you seen, or what do you expect to see that will really impact health IT now and moving forward?
Yeah, I mean, very clearly, the second Trump administration is just laser focused on deregulation. I think a lot of that comes from the Office of Management and Budget, led by Russ Vought. And he is just directing all the departments, all the agencies to find as much deregulatory opportunity as possible. So having had conversations with some government leaders, that is their number one task. And so we're starting to see that in health IT, less than in some other places. Deregulation is not fast. It actually ironically requires regulation, right, to deregulate. And so they have to go through a process. So they're collecting ideas. There are a lot of RFIs and other asks for deregulatory ideas that are out there right now. We have submitted some through the Electronic Health Record Association, a pretty lengthy list. And I think my perspective is it isn't about getting rid of all regulation. Most industry is in some way favorable towards regulation because you want to know what your guardrails are. You want to know should you be focused from a standards perspective, for example. But you don't want too many, and you don't want burdensome, and you don't want ones that for certification, as an example for health IT, that you do only because of regulation and not because the market sees benefit or your clients are embracing it and saying, yes, give me that new functionality, right? So that is the balance. And that in the messaging that we have we've submitted to ASTPONC, we're submitting some to CMS, we've submitted some to OMB. All these different people are asking for the same thing. But as we submit that, we're really trying to say, as the regulated industry, we aren't trying to get rid of everything. We just want it to be more narrow. We want it to be more useful to our clients, less burdensome to us, so we have more room to innovate.
Yeah, absolutely. And what areas do you find to be the most common ones where they're asking for support or you're submitting?
I mean, there's a lot of focus on the certification program because that's such a driver for health IT regulation at the federal level, right? So we're really talking federal. But, just from our perspective, let's narrow in on interoperability use cases. Let's narrow in on where standards still need to be developed and promulgated through the certification program. Let's lose some of the other stuff that has kind of weighed things down and not necessarily been welcomed by the market. We've put a lot of things into our products taking development hours, requiring services deployments. Our clients have to be kind of bothered by a mandated upgrade, right? That is purely for regulatory reasons. And we want to move away from that and focus more in on the things that we have found to be useful. The standards promulgation around interoperability has been really, really useful for the industry. And so we're saying, all right, let's narrow in on that and have that be the focus. That's for ASTPO&C. CMS is more advocacy for what's useful for our clients, right? CMS regulates our clients as healthcare providers. And so our messaging there has been these quality measurement requirements are too much or burdensome or difficult, or let's streamline these or let's consolidate. And then we have ideas for the CDC. We have ideas for FDA. So, any agency, we could give you some ideas for sure.
I love that. That makes so much sense. It really does. And I'm so glad you're on the forefront of this. So I'd love for you to remind our listeners, what's the role that you play at Altera and what is Altera? And then what is the role you play at EHRA and what is EHRA?
Yeah, sure. So Altera Digital Health is the company that I work for. Previously, we were part of Allscripts. So Allscripts kind of divided and became two different companies. So Altera Digital Health is one side of that. I've been with the company for more years than I would like to admit, but I just hit 25 years with the company, but it has felt like a lot of different companies because of mergers and acquisitions and things like that. But we are now Altera Digital Health. So we're part of the Harris Healthcare group of companies. And so we've got a really nice constellation of all of these different parts of health IT. So my role is leading the government affairs function, the regulatory affairs function. We have a pretty robust regulatory compliance function as anyone in our space needs to have now. But I am kind of the in-between role between those outside stakeholders, trying to talk to them about, have you thought through this kind of inadvertent consequence of this proposal, right? Leading the comment process and then also bringing that stuff internally and working with my team. We've got a great team of folks, and we work to make sure that the company understands requirements. So that's Altera. I also am currently chair of the Electronic Health Record Association. That's a volunteer position. EHRA, we have a few staff members who support us, but we're largely volunteer-led. And so 27 different companies from across the industry. It's our trade association. And so we all come together and work together largely on policy-oriented topics, as you can imagine, because policy just affects so much of what our companies do these days. But I am helping to lead that group. We've got an executive committee of 8 people who help kind of run day to day and make decisions and strategy and all of that. And it's really great. I mean, it's a great group of really smart people who come together and share information as to how we can all advocate collectively. From my experience, it is really effective for the trade association to be the voice of concern on topics because it's more than one company. It's not just Altera's voice. It's 27 different companies coming together and saying, this is a problem, or we have this concern, or we have this question. And so it's been a really effective tool, even just kind of helping Altera's goals through the EHR Association.
Absolutely. And to just be able to join in as one voice with similar goals and needs as companies to be able to come together and unite would absolutely make such a bigger impact. So we talked a little bit about federal regulation and deregulation, but I'd like to talk to you about what you're tracking on the state level. What are things that are of interest to you right now as you're thinking about this with your roles that you're in?
Yeah, this is an interesting area right now. I have been in this role of running our government affairs function since 2008. So it's been quite a while, right? But it's really been an evolution because when I first built the role, O&C existed, but HITEA hadn't been passed. Things like that, right? So imagine how much the industry has changed, but all of these various agencies and all of this at the federal level started regulating us or having an interest in the data that comes from our systems. So what we knew was the goal was for data to become available and accessible and helpful in numerous different ways. And the states have kind of discovered this at this point. So a few states have acted over the course of the last couple of years. There are more active states around policy, as you can imagine, California, New York. Washington State. There are a few states that tend to be a little bit more active, but most people have largely deferred to the federal government until the last year or two. And what we've started to see is just this explosion of laws that are being proposed at the state level. And that's an interesting challenge for us. Not everything passes. I mean, the passage rate for state laws is anywhere from 9 to 21%. I mean, a lot of stuff gets introduced and falls off, right? But you don't know when it's introduced, what's going to fall off. And ultimately, the challenge that exists is that we then have all of these other requirements that we have to satisfy. And it can be a law that affects us, that names software developers as an actor that's implicated, or it can be just something that affects our clients, but they need our help in being compliant. And so what it does is as these other things come up, whether it's right now AI, very hot topic in the States for sure, but there's a lot of other topics. There's privacy and consent topics around consent management and sensitive health data, like related to reproductive health care or gender affirming care. Those are kind of a trend right now in a number of states. Also, some kind of like niche things like where can data be accessed? So can health IT data be accessed from offshore? And that has implications for where support people are employed, things like that, right? So there's all these things kind of coming in from the edges. And this is all while we have to be compliant at the federal level. So it can really present a pretty significant challenge for us to not only have DC to think about, but also all these other states that are starting to really add more and more things that we need to be tracking and complying with.
Absolutely. And how is it different? Because I know Altera Digital Health is in other countries. How is it different in other countries versus the US?
Yeah, I mean, that's a great point. It's a challenge. I mean, you can imagine the EU takes a different approach than Singapore, than Australia, right? And so where we have products that are in all of these different countries, that's more to comply with. And they definitely are not always the same by any stretch of the imagination. I mean, the EU has already taken an approach around AI. They've already started taking action. They have the GDPR, which is their privacy law. And so it's just kind of more and more bosses to please. And from a technical perspective, that's difficult, right? Because then your product has to have, how do we satisfy this over here? But this over here is different. And the concern is that we're starting to look at that same disparity and sometimes conflict within the United States. So it really makes development and compliance much more challenging.
Yeah, absolutely. I can only imagine that. So I'm wondering too, as you're kind of thinking about the US and policy and affairs, government affairs, what is your take on federal versus state level health IT regulation? How does this affect different healthcare stakeholders? And yeah, what is your take on it?
Yeah, I mean, our preference is absolutely a federal framework for any policy that we are talking about. So certification has been a federal program, right, since 2011. And that tells us one set of requirements. It doesn't mean that there haven't been some little things in the various states, but it's much easier. Right now, we are looking for and hoping for a federal framework on AI because it's a hot topic, and on privacy and security because with all the cybersecurity breaches and things like that, there's a lot of attention on it. And without that framework, that's where these states start passing things. And so one concern we have in the current deregulatory environment under the second Trump administration is that if the pendulum swings too far to the deregulatory side, the states will start to say, we're not getting what we're used to from the federal government. There are a lot of state laws that point to the federal government. So there are a lot of state laws that will say, you're okay. So here's an example. In Nevada, there's a requirement that there's various staggered deadlines. Healthcare providers need to either be connected to an HIE on their own or they need to be using certified health IT. The certified health IT that they point to is from DC. That comes from ASTPO&C. If the federal government swings and really doesn't kind of keep things moving on a certification perspective, those states don't have that same place to point to, right? And so it becomes a risk to us that particularly certain states we could see coming up with their own certification. So then we would have not only DC certification, but we would have maybe California or Maryland or Minnesota or New York. And that is not what we want. So we really prefer to see that come out of DC. We want Congress to take action on AI and health AI specifically. And we want Congress to take action on privacy and security so that we don't have kind of 50 different flavors. We're not looking for Baskin Robbins regulation of health IT.
Oh, absolutely. Absolutely. So now we're several years into initiatives targeted to minimize or eliminate information blocking. So I'd love to talk information blocking with you. How do you think we're doing as an industry with this? And where do you think we're going?
Yeah, it's a great question. We just had our 5-year anniversary of the information blocking regulation. So that came out in March of 2020. I felt like we should have had a little cupcake or something with a 5 on it because it really changed the industry. I mean, prior to that, there were a lot of conversations about information blocking that were taking place in Congress, that were taking place in various places. And the EHRA Association had a code of conduct in which people who signed on to it explicitly said that they wouldn't block information. So it was part of the conversation already. But then it was passed in Cures, in 21st Century Cures in 2016. And it took ASTPONC years to put out the regulation. So that in and of itself was a signal of how complex it was going to be. And so it came out. We all kind of processed it. And generally, I would say the regulation was helpful in that it codified certain expectations, particularly the exception structure that we all use to explain why in certain instances information doesn't flow, why an agreement can't be struck as requested, but here's an alternative manner that we can use, right? Things like that. So it definitely helped from that perspective. I do think it forced some behavioral changes among some of the stakeholders, and that can only be good. Information should not be a commodity that is hoarded, right? It should move. There should be patient ownership, like unquestionable patient ownership of their own data. So all of that is a positive. We're not done with it, though. There are a couple things that I think are worth commenting on. Number one, the disincentives that they put out for providers was really insufficient. They felt, ASTPONC felt that the statutory language of Cures really only allowed them to put out disincentives for information blocking for providers who participate in programs like MIPS, ACOs, things like that, right? So kind of the more advanced. The problem is that those people are already using a certified health IT. They're already probably more compliant just by inherently participating in those programs. So they have this disincentive program that's kind of going after people who are more likely to be sharing information because of their participation in these other programs. What they didn't do, and I understand their statutory read, but what the gaping hole that exists are providers who aren't participating in those. So physician practices or whatnot who aren't participating in programs like promoting interoperability, but also really critical stakeholders in healthcare like labs, pharmacies, other people who are key to that information exchange process, but they still have proprietary interfaces. They still have their charges that they come up with that wouldn't be compliant with some of the exceptions of information blocking if they were subject to it. So we would like to see, in terms of advocating for really true free flow of information, that more of those critical stakeholders get brought under that umbrella of information blocking. The last thing I'll say on it is that we're really seeing clear signals that this administration wants to ramp up enforcement, more investigations, penalty collection, et cetera. And so it'll be interesting. We'll see kind of what happens. What does that look like? Who do they go after? The majority of complaints about information blocking are about provider organizations, but the federal government collects money, direct penalty money from health information networks or exchanges and software developers if they are found to information block. So there's a little bit of a perverse incentive there to go after kind of the technology side of it. So I think we're going to see a lot of action there in this year and the next year.
Absolutely. Let's hope so. Now, as the chair of the EHRA, what are some of the big initiatives on tap for the organization this year?
Well, a lot of our work is definitely driven by policy. So what are we seeing in the conversation in DC and at the state level? We have a public policy leadership work group. We did just add a second vice chair position focused on the states because that has become such a dominant point of conversation. We were having so much conversation about the states that we weren't getting to other things in our calls. And we said, okay, hold on, we need to add another call. We need more focus on the states because this is so dominant, right? So that's an example of where we kind of evolve as the industry evolves. I mean, we have 11 different work groups and task forces plus 2 committees that kind of run the day-to-day. Those are everything from standards and interoperability. Patient safety is obviously an always important topic that we need to talk about. I mentioned public policy. We have a new AI task force, and we have a new task force on privacy and consent that we created largely in response to a law that California passed, AB 352, which essentially limits how much reproductive health data and gender affirming care data can leave the state. So it creates a need for data segmentation that's really challenging for vendors because standards aren't finalized yet. There aren't mature standards yet. And so you can kind of see these things happen and we put our heads together and we say, okay, are we equipped to handle that, right? Or do we need to adjust? And so there's a lot of conversation taking place on those topics. AI for sure, because there's so much conversation around AI and so much conflicting conversation around AI. So that's a very active work group that gets really, really good engagement. So we kind of look at what are our members worried about? What are they staying up thinking about at night? And how can we serve them in convening people and talking about it?
Absolutely. So fascinating. I absolutely love learning from you, Leigh. You are the best. So my listeners love to learn from women in health IT about what's going on in the space, but they also like to learn about you as a woman and a leader and what you do to work your best to make a difference. So tell us, are there any habits you have in your personal life that keep you at the top of your game so that you can do all this amazing work that you're doing?
I will say work-life balance. I've been really lucky through my string of kind of owners of the company that I've worked for. There's always been a respect for work-life balance and a recognition that people have stuff going on outside of work. I joined the company as a newlywed and had 3 kids, and my youngest is now turning 17 next week. So
wow.
I've been through the ringer of babies and juggling and all of that. I have a fantastic husband, thankfully, who is very much my partner and shared that. But I've also been lucky to work for bosses who really kind of supported my journey and supported my growth. I mentioned that mentor. His name was Rich Goldberg. People who listen to this, some of them will know him because he's been in health IT for so long. But just working for people who said, what are you interested in? And what are you passionate about? And let's find things for you to do, right? And who really respected my expertise as I built it in health IT governing in particular, right? Like what's the government doing? So it made my job enjoyable. I mean, I genuinely enjoy my job. And I think that also makes it easier, right? It's a lot easier to wake up and get to the laptop when you like your job and you are excited by it.
Yeah. And so what does work-life balance look like for you?
Well, at this point, I've got 2 kids who are, one just graduated college. So yay, no more tuition.
Congratulations.
That's good. And then I've got another in college and one who's going to be a senior. So luckily they are pretty self-sufficient at this point. Because I enjoy my job, I do sometimes sit at night and keep working. But, largely, I mean, it really is just about drawing your boundaries. I mean, I think my advice for young women when they ask, well, how do you navigate this or how do you deal with a difficult situation at work or whatever is be respectful but firm in your boundaries, but also don't make yourself small. I mean, I think a lot of women in particular, especially newer in their career, will make themselves small. And you want to learn, you want to soak up everything you can from people who know more than you. Either they know more about health IT, or they know more about business acumen, or they know more about negotiating a tough situation or whatever. Soak that up, but also be confident in what you bring to the table, because that's how you get recognized as someone with something to say, right? People who you'll get invited to the meeting, you'll get given the big project that maybe feels really scary, which I certainly had when I was young. I was handed huge projects and had to figure it out, right? But that's because I kind of said I can do it. And so that's always my biggest encouragement to people, is know what you're good at, know where your skills are, and be confident, be strong in who you are, because you deserve to be heard in that meeting or whatever.
So inspiring. Don't make yourself small, people. Don't make yourself small.
Absolutely.
And live up to the challenge of whatever is put in front of you. So to finish this conversation off right, where can our listeners find you online?
So I am on LinkedIn, and that's probably professionally where I am. I'm not on Twitter as much anymore. I never was a huge person for Twitter, but LinkedIn is where I tend to post things. That's certainly where you can find me.
That's terrific. Now, before I forget, tell us what tea you brought with you today, and let me see your mug.
So I've got my Wonder Woman mug. This is my mug because I got it when my middle guy was so into superheroes, as a lot of little kids are, but he was really, really, really into Superhero Squad, which is like the cartoon with the little mini people, when he was like 3. And he saw this mug in a store and said to my husband, "We have to get that for mommy." And so I've had it ever since. I mean, it's old as you can't see, but it's got like kind of cracked ceramic and whatever. So I've got my mug, and my husband makes sweet fruit tea. It's sweetened from the fruit, but we always have a thing in the fridge of that. So I think we've got pomegranate orange seems to be the flavor right now.
That sounds delicious. And I love the story behind that, especially because he saw you as Superwoman and he knew that would be a perfect mug for you because of who you are. And I see you as Superwoman too. So thank you so much. And thanks for joining us today. And thanks to you folks for joining us too. Check out the HITea With Grace podcast for more interviews with great guests like Leigh today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.